Welcome again to the video. I have not recorded anything in a bit, even though I have done a few things. So what I will do is just talk through what has happened and let you have an update on me and my body and how I'm feeling mentally and things like that ever since the surgery on the 28th of April. And today is now the 9th, which is Mother's Day. So I know you're going to see this way after the fact. So last week I had quite a few doctor's appointments. I had my therapist appointment, which is something that is ongoing, which is definitely needed for this sort of process, and I will get into the importance of it in a bit. I had my GP appointment. I had another GP appointment. We'll get into that. And I had my hospital visit. In the video beforehand of my surgery and the days right after the surgery, I did note that I would have a dressing clinic to attend, and that's what I went to, but it turned out to be something quite different, so I'll let you in on that as well. Let's start at the beginning. The first thing that I had was my GP appointment, which was the transferal of information from the hospital, like the reports that I had. I had two separate reports that went to my actual GP, and then my GP was meant to follow up on that because of my iron situation, had anemia, and still have it as far as I know. Anemia and my blood pressure situation, and the fact that I had surgery and what was involved in the surgery, as well as the complications of the BIA-ALCL. All of this was meant to be talked over with my GP. Unfortunately, that's not how it went. Let me just whittle it down real small, because that's how small the call was. Call didn't last very long at all, and we didn't really hit any important points. Why am I bringing this up? Because it is so vital for care to be adequate in order for the patient to feel as if they're heard. Their stress levels wouldn't go up, actually they would fall. They would feel more at peace. Even if it is a difficult situation, they will feel better because they're being heard, their situations are being taken seriously. Now, if that isn't happening, you will have a stressed out patient who is constantly trying to get their points and their views across. They're constantly trying to translate what is going on with them, and that unfortunately doesn't augur well in the mind of the patient. So on behalf of patients, since I am not a medical practitioner in any sense of the word at all, I can only say on behalf of us, we need to be heard. We need to be taken seriously. Even if it is a small situation or seemingly small situation, it is important to us. So take us seriously, please. The second bit is from that appointment, I went on to the appointment with my therapist. Now, it is so vital to have appointments with your therapist at this time. Why? Because these situations are quite big, quite a lot to be dealing with as well. I am suffering from fibromyalgia, which means that sometimes I just have spots of when I don't have energy, spots where I have depressive disorder, spots where I have dizziness, when I have other things going on with me like numbness, palpitations, all sorts of things that are happening in bits or at the same time as everything else that's going on. Remember, I also just had surgery. I have this suspected BIA-ALCL, and I will talk further about that regarding results. But all of these things going on at once, those are really stressful things. And even though personally for me, the way I am dealing with them, it's not really stressful, the situations surrounding the things are stressful for me. Like for instance, trying to garner support, trying to get folks to help me do things, and trying to sort out things for myself. Those are the things that are causing me stress. So regardless of what stressors they are in major situations, or even in situations where others may not think they're so great or major, you still need your therapist by your side. You're going to need that person that you can speak to freely, that you can air your views, and that person can give you ideas on how to deal with situations. You need a therapist, someone who is constant, that will walk with you throughout your journey and will have the time to pay attention to you. That person is meant to be there. That is their job. They're trained to walk with you through your journey, especially the hard, the rough ones. So this is why I've made sure to have my appointments set up throughout this entire time, so that this constant person will be with me throughout. Now, thankfully, I have a situation set up with my work so that is covered. Other folks may not be able to have that available to them, but there are people out there who will be willing to listen to you. Not everyone who is a good listener is necessarily a therapist or a life coach or any other such thing. There are folks out there who are willing to listen to you, whether they be family or friends, someone like that, a loved one, but find the right person. Not everyone who listens will be willing to stick around for the entire time listening to you. So that's one thing that you're going to have to pay attention to. Find the right person. Throughout rocky seasons like these, like medical problems, waiting for hard results, anticipation of some really tough times. It doesn't even have to be only health-wise. It could be with your work. It could be financial. It could be something with family. It could be some other thing that is rough. You need someone who will understand your dips and your rises in your mood, because not everyone can handle that. Believe you me, some people will question you and then you will feel worse for it. But it is not because they don't want to listen or whatever the case may be. They may not be capable of listening. So you have to find the right people. And once you find the right people, they don't have to be many. Make sure that they understand where you're coming from, what you may need from them, and listen for the cues that they really are there for you, like them telling you that they're not going anywhere and actually acting it out, because people can tell you that they're there for you and they're still not there for you. This is just human nature. But once they act it out and you've seen it happen, then you can use those people as your sounding boards as well. You don't necessarily have to stretch your pocket to find a person. So that's just another way for you to have your people around you. So after the therapist, I spoke to another GP. I was able to run through what I would have needed from my actual GP, which was follow-up regarding the anemia, as I said, and she gave me advice as to what I can take. And I do have some things that I have to get. Actually, I have to follow up on that, but I've been trying to work on my own diet as well, and I will say something about that because that has changed. And so she has helped me feel a lot better when it comes to stress about the medical aspect regarding the GP. She has made me feel way better because I've gotten concrete answers from her and no nonsense answers, but still empathetic, which is exactly the combination that you need, which, going on to the surgery, I get from my surgeon. When I went to the hospital to get my dressings changed, the dressing change actually turned into a conversation with my surgeon. He really wanted to see me, so he let the nurses know that when I came, that he will come down from theater and come and talk to me. So that's exactly what he did. He came and he spoke with me. I actually was in the room. I changed out of my top and stuff and put on the gown, and I was thinking, like, what does he have to say to me? Have results come already? It's a bit too early. I was thinking all of that. I wasn't scared or anything, but I was just wondering what the conversation would be like. But I really wanted to see him because I really enjoy talking with him. And he came in, we spoke. He told me exactly what was happening inside my cavity, about the trauma that's there, about the rupture, about how all the fluid was in my chest and the inflammation. There was a lot of it, and he greatly stressed that the healing for this is going to take quite a while. I addressed the pain that I'm getting on my left side. I still have it. I get some pain on my right as well. I will address how my chest looks, and I will talk about that in a sec. But yes, I was getting some pain that was ongoing. It's still there. And he mentioned that next time we meet, which will be in a few days again, we may need to scan it. Maybe or maybe not, we will have some results then. We don't know yet. Right, so he did palpitate. The area was not hard at the time. However, I did feel some stuff last night, and some bits feel harder. I don't know if it's just scar tissue underneath. I am not sure what it is. But I do know that I will be in good hands once I go back to the hospital and the doctor takes a look. So I will be able to talk more about that once I have my next appointment. But at the moment, I still do have some pain. I still do have some discomfort. The healing, I think, is happening very well. The dressings did not need to be changed last time. He said they were good and it would hold until next time. I do know that the healing is progressing because there's itching where my incision is. So that's frustrating. It's like having a cast, I believe, because I've never worn a cast. Having a cast and not being able to scratch that itch, oh my goodness, is the most irritating thing. Swelling and settling of my chest could actually take from 6 months to a year. My chest is swollen at the moment. In my video that I have up before, which is the one with the exercising, I mentioned that I had some padding in the sports bra. That is now out, so I just have on a sports bra, but my chest area is swollen. This is not how my chest area is going to end up being. It looks like that way now because I've had surgery, because there has been trauma. A lot of digging around was going on. Thus, my chest looks like this. This situation can make people believe that, oh, but what does she have to worry about? Oh, but she looks nice. I mean, why did she think that she needed implants? That's not how this goes. Please, I'm telling you this now so that when you do talk to other people with these sorts of situations who have had implants and had to go through an explant and a capsulectomy, do not tell them something like that, because first of all, it's insensitive. Second of all, what you're seeing is not how they're going to end up being. So things need to settle. My muscles need to settle, and then the tissue needs to settle. Everything else needs to settle before my chest finally settles. If you are a person going through this surgery, be mindful that your chest is going to change a lot in the next year. It does change. It's going to seem perky. Well, at the very, very beginning, your chest are going to look, their boobs are going to look a little strange. And then a few days later, they're going to look really perky. But that's going to change. They're going to settle down and they're going to become flatter. Be prepared with the right bras. Be prepared with the right sports bra for support, especially at first. You're going to wear sports bras, the closest ones, the tightest ones. There are some that are made for post-surgery, and you can get those. The ones that fasten in the front, I have one that is especially made for post-surgery that has fastenings in the front. And then I have those like the one I have now that has zips in the front, but make sure they hold you as tightly as possible for adequate support, because you're going to need it at first because of the incisions and the healing and all of that and the pain. So after all of that has passed, after a whole year has passed, then you're going to start getting into the range of what your chest really looks like. And you may be a bit disappointed if you really wanted the perky boobs. It all depends on what you started with. Those who are around you, you need to research and understand that this is a very, very vulnerable time for patients who are going through this. Even though they may seem well and all of that, there's still got healing going on inside there. So that you still have to be careful with them, even though they may seem up and at them and everything. Just be careful and help them with lifting things, reaching things, doing things, because even though we look and seem fine, our body is still healing and it's going to take time. So you still have to be around to help. If you want to help, just be around for the long haul. That would really help. Mental situations also help with the healing. So if you can help, it will help with the mental situation, which will in turn help with the physical situation. It's as simple as that. Remember, I'm not a doctor. I'm just a layperson. I'm just me who is going through this experience and who's willing to share my experiences with you. I will implore you, do your research. Whether or not you're a person going through this, do your research. Whether or not you're a man, woman, transgender, LGBTQ plus, it does not matter who you are. Do your research, because you never know when any of these situations that are going on with me could ever affect you. I am enduring with fibromyalgia through all of this. I had a ruptured implant, which in itself is also rare. I do believe I had a bit of BIA, which is breast implant illness, which is also rare. And of course, there's highly suspected BIA-ALCL because of all the things that I've been presenting with, which is extremely rare. Do your research. Share with others. Let people know about these things, because there are folks out there who are suffering, who have no idea what they're suffering with, because they're not straightforward to find. They're not straightforward results to gain. Going to your everyday GP would not result in having these sorts of results or any other results that there may be that are rare issues. So we must grow awareness so that folks like you and me could be well informed, better informed, so that when we go to our doctors, we can have our research in hand, and then hopefully we can have a discussion with our doctor about all the possibilities, and then we can probably get the right tests. It doesn't mean that you have X or you have Y or you have Z, but at least you're better informed and you can highlight things to your doctor and get some questions answered. So this is it for me for the time being. I will speak to you again once I've had more results, most especially about BIA-ALCL and what's going to be happening with me next. Also, I will be talking further about my fibromyalgia. The discussion definitely has not stopped there. There are other things that will be happening into next month. regarding fibromyalgia and me. So I want to share that with you so that you will know what to go through, what to talk to your doctor about, what to expect, things of that nature. So until then, do comment, like, and share if you've gotten this far. I really do hope you've gotten this far, and share this video, like this video, because the algorithms like it. Once you like it, then more people will come and watch this video, so that more people can get involved and be informed to get in the conversation, and everyone could be informed. Okay, so you take care, and I will see you later. Peace.